Hello. My name is Jones, and today we are going to look at minor disorders in pregnancy. Minor disorders in pregnancy are disorders that occur during pregnancy and are not life-threatening. These disorders include nausea and vomiting, heartburn, pica, constipation, backache, and fainting, then varicosity. Okay, so let us discuss some of these in detail and their brief management. So when you talk of nausea and vomiting, this presents between 4 and 12 weeks gestation. Hormonal influences are listed as the most likely causes of nausea and vomiting. It usually occurs in the morning but can occur anytime during the day, and it is aggravated by smelling of food. How do you manage nausea and vomiting in pregnancy? Firstly, you need to reassure the patient as something which is stemming from the hormonal background and changes within these hormones, and also you need to encourage the small frequent meals for this mother, as it will reduce on the vomiting and the age to vomit, which is nausea. And then you need to encourage the woman to reduce fatty fluid containing foods, as they precipitate the feeling of nausea. And also you also have to encourage the mother to rest, as it prevents muscle irritation that may predispose to vomiting. Then we can talk about the second minor disorder in pregnancy, which is heartburn. Well, looking at heartburn, it is actually a sensation in the mid-chest region, which mostly has that feeling of burning sensation, or we can say it's a burning sensation in the mid-chest region. Progesterone relaxes the cardiac sphincter of the stomach and allows a reflux of gastric content in the esophagus. Heartburn is most troublesome at 30 to 40 weeks gestation, because at this stage there is a lot of pressure from the growing uterus. How do we manage heartburn? Heartburn is managed by encouraging the woman to take small and frequent meals. It is managed by encouraging the woman to be sleeping with more pillows than usual. It is also managed by helping the woman to pop up. This is to reduce chances of refluxes. It is also managed by persistent severe cases where antacids have been prescribed. Then this woman may feel this heartburn. Where there's persistent prescribed antacids, the woman may start feeling this heartburn. Then pica. Pica is a term used when mother craves certain foods of unnatural substances such as coal, soil, and the likes. The cause is unknown, but hormones and changes in metabolisms are blamed. Management of pica. This can be managed by encouraging the woman to seek medical advice if the substance craved for is potentially harmful to the unborn baby. Then the fourth minor disorder in pregnancy that we can talk about is constipation. Constipation results from the effect of progesterone that causes relaxation and decreased peristaltic activity of the gut, which is also displaced by the growing uterus. How do we manage constipation in pregnancy as a minor disorder? You can encourage the woman to increase on the intake of water, fresh fruits, vegetables, and roughage within her diet. You can also encourage the woman to do exercises, and in this case, walking is quite helpful. Then the fifth minor disorder in pregnancy is backache. Backache results from laxity and softening of ligaments due to hormonal changes. There is also altered mechanics and biomechanics due to enlarging uterus, causing this backache. How to manage a backache is by advising the woman to sleep on firm bed and also advising support mechanism for the back. Okay, the sixth minor disorder in pregnancy is fainting. In early pregnancy, fainting may be due to the vasodilatation occurring under the influence of progesterone. The weight of the uterine content presses on the inferior vena cava and slows the return of blood to the heart. How do we manage fainting in pregnancy or fainting episode within pregnancy? You have to encourage the woman to avoid long periods of standing and also encourage the woman to sit or lie down when she feels a slight dizziness. You can also encourage the woman to lie on her back. Okay, so you can encourage the woman not to lie on her back except during abdominal examination. This prevents pressure on the vena cava. The seventh minor disorder in pregnancy is varicosity. Progesterone relaxes the smooth muscles of the veins and results in sluggish circulation. The valves of the dilated veins become insufficient and viscosity will result. This occurs in legs, and in the anus we see hemorrhoids, and it can also occur in the vulva. Management. You can encourage the woman to exercise the calf muscles by rising on their toes, and you can also encourage the woman to elevate the leg and rest on the table and support the thighs and the legs. You can also encourage the woman to avoid constipation and also advise on adequate fluid intake. You can encourage the woman to use centered pads and give support for the vulvar viscosities. So in this way, you're going to manage viscosities in pregnancy. Otherwise, other than the minor disorders in pregnancies that have been discussed, the following danger signs should be looked out for and may require immediate action. For instance, if we talk about vaginal bleeding, it can be a sign of a threatened abortion. When you talk about reduced fetal movement, we can be looking at an issue of intrauterine fetal death. Okay, then there are also other danger signs that can be looked out for, like frontal or recurring headaches, sudden swelling, rupture of the membranes, premature onset of contraction, maternal anxiety for whatever reason, persistent or unusual headaches, persistent nausea and vomiting, dizziness, disturbances of eyesight, pain or cramps in the lower abdomen, swelling of the hands or feet, decreased urine production, any illness or infection, tremors, that is shaking of the hands, feet, or both, seizures, or rapid heart rate. So in this discussion, we're looking at minor disorders in pregnancy. So the minor disorders in pregnancy that we discussed include the nausea and vomiting, heartburn, pica, constipation, backache, fainting, and varicosity. So we also looked at the brief management of these minor disorders in pregnancy. And we also talked about the culprit hormones or factors that are leading to these minor disorders. In the summary of the lesson, we looked at danger signs that a pregnant woman needs to note, which included vaginal bleeding, reduced fetal movement, disturbance of eyesight, pain or cramps in the lower abdomen, decreased urine production, and the likes. So thank you very much for listening. You can also listen to other obstetric obstetric lessons that we have recorded, and other lessons that we have recorded in other subjects. So please keep studying.